standpoint, it makes sense. And even I could agree that there's nothing wrong with private delivery as long as the funding is 100% public. But the big but is that in the real world, those things are not separate. Experience, international experience, demonstrates that as soon as you introduce corporate delivery, the private funding comes up. Sometimes from behind the door, you don't know where it's coming from. Sometimes because, people act illegally or they bend rules and all that. And sometimes because it comes, in big flows after a while. So this intellectual distinction that we make, which may make sense, which may make us lean toward and we say we'll be reasonable and we won't be so dogmatic and we'll accept, to make this difference, it doesn't. Because they will be intertwined and private funding will come with. The third principle that we have to be aware of is that those changes are actually occurring slowly and in a piecemeal manner. One change here, one change there. And it's difficult to see the overall picture and where we're heading up. I think I gave you enough example of the structural changes which don't seem at first connected to realize that they're part and parcel of the same project of reinforcing privatization of healthcare. So they're done slowly. I'm being just a bit sarcastic, but not too much, for two reasons. Because the citizen is not supposed to see what is occurring, what is happening. And second, because those changes involve major structural changes into our public system itself. Okay, let me express that in other words, in different words. In order to create or to extract out of our public Medicare private segments, the créneaux, what's the word in English? Private section of the markets which can be rewarding, and you need to change the public system itself. Take, for instance, the creation of those centers to perform day one surgeries outside the hospital, right? Say you take the big hospital in Toronto, and you say, well, cataract, cataract is, it's a perfect example because you can do a high volume. You know exactly how long it takes. You can run a business of cataract with almost zero risk, with foreseeable costs and all that, and make a profit out of that. Because very rarely, and you, of course, you select the patient. You don't take a patient with multi-pathologies, into a private clinic outside the hospital. You take, the healthy patients outside the hospital, you send those to the private enterprise, and you send them with contracts. They have a high volume, and the contracts say, we pay you so many millions a year. We say, you're going to take so many patients, but even if we can't send you that many, you're going to be paid for. It's very interesting to look into the details of those contracts to see that the private enterprise is almost zero risk into those. But in order to do that, you need to reconceive or reshuffle services within the public system, because you're not going to do those things anymore in the public system, right? You're going to subcontract them, outside. So I repeat, the idea is, in order to create those private markets which need to make money, it goes without saying, you need to reshuffle things around in the public system. So you can't do that overnight. It takes time. And this is happening too across Canada within our public system. Reshuffling things inside in order to create those markets outside. The fourth principle to understand when we look at things and try to comprehend what is going on is to remind ourselves that no private health market can be viable without heavy public support. Regardless of all the rhetoric about private enterprise, creating, working outside the public system, they do their own things. Nothing of the sort is going on in healthcare. Private enterprise, private hospitals will need heavy public support, both in terms of redesigning public policy on the one hand, and money, cross-subsidization through contracts, for instance, and other mechanisms like, think of private insurance. Well, as soon as the government says you buy insurance and you can deduct it from your income tax, that's public money going into it, because that means people who are not buying private insurance are sponsoring and subsidizing the people who are buying it, right? So public funding of private enterprise is always there and is a must. And when we try to understand and analyze what is going on, this is an important principle to remember. And the fifth and last principle is that, of course, every privatizer of this world will say that they support a strong public system. They're not lying. That's the truth. Because a private system or a privatized system is only done through a certain extent. You only extract what can be lucrative out of the public system. What is not lucrative will lie and stay with the public system. And because we live in an advanced society where it is not acceptable anymore to think that that some of our fellow citizens are left out somehow or other. I mean, even in the States, that's why there's such an outcry about the medical system in the States, because people can't accept anymore the idea that so many millions, in that case, of citizens go without health insurance and go without services. This is not acceptable anymore in our society. Therefore, in order to be viable, the private system understands that they need the strong public system to look after what is not lucrative, to look after the heavy cases, to look after the minimum that everybody is still entitled to. But if they recognize that everybody is entitled to a minimum of care, they still want, this kind of gold standard for other people for certain services. But one cannot come without the other. So privatizers will always say that they support a strong system. But a strong system released of its lucrative segments of the market, which will be taken out of the system. So I believe that what is occurring is major. It's occurring all across the country. We're all in the same boat in that respect. We must learn from one another to try and decipher the different techniques and strategies that are being used by our politicians, but also by our, be they the right-wing think tank that we have from west to east coast to understand what is going on. And so we have a duty to see, analyze, and denounce what is happening. And that's why I want to thank you for being here tonight, and for being aware and being active on that front, because we certainly need every one of you in that front.